Scars can often not only leave a physical mark, but they can also affect people mentally. Even though you can't remove scars, there are ways to help treat them and make them less visible. In this video, I'll be sharing answers to some of your most asked questions about why scars occur and how to improve the appearance or feel of your scars, including your surgical options. I'm Masha Singh, a consultant plastic and reconstructive surgeon at Shirley Oaks Hospital in Croydon, and I've been treating patients with scars for over 10 years. So I've seen a wide range of scars and helped to improve their appearance. So, what causes scarring? A scar is a mark that is left on the skin after a wound or an injury to the skin has healed. Scars are permanent. However, they usually fade over some time. Scars can be caused by a wide variety of things, including burns, injuries, bites, body piercings, tattoos, surgery, and complications from conditions such as acne or chickenpox. But what are the different types of scars? The type of scar formed depends on several things, such as how the scar was caused, the patient's skin type, and their genetics. Types of scars can include the following. Flat, pale scars. These are extremely common. They'll often start off red or dark and raised. However, they will become paler and flatter with time, usually over a period of about 2 years. Hypertrophic scars are raised red scars that form a longer wound, and these scars can stay like this for many years, but do ultimately tend to flatten and become paler to some degree. Keloid scars form due to excess scar tissue produced at the site of the wound. Most keloid scars continue to grow even after they have healed. Keloid scars are more common in certain body parts, such as over the chest, the shoulders, and the earlobes. These scars can be itchy and sometimes painful. Pitted scars are sunken-looking scars and are often caused by skin conditions such as acne. Contracted scars are mostly caused by burns or scalds. The skin appears tight, which can restrict movement, particularly when the scars cross joints. And finally, stretch scars. These tend to be flat and pale, but are wide. They tend to occur in patients with thin skin who may also have stretch marks, or when wounds are closed very tightly. So, what are the options available to treat scars? There are a range of treatments available for different types of scars. Options will depend on the type and age of the scar. They can't completely remove the scar, but they may drastically improve the appearance. Pressure garments. Pressure garments are often used for scars caused by burns or after skin grafts. They are used to flatten and soften the scar, and they're usually worn 24 hours a day for between 6 to 12 months. Pressure garments can also be used to treat hypertrophic and keloid scars. An example would be a clip-on earring style pressure device, which can be useful for treating keloid scars on earlobes. Silicone gel treatments. Silicone gels or sheets have been shown to improve scarring when used for 24 hours a day for at least 2 months. Laser therapy. Laser therapy reduces scar redness by targeting blood vessels, often used for flattening pitted scars. Dermal fillers. This treatment involves injections to essentially fill pitted scars. Using dermal fillers as a treatment for scars can be expensive, and you will need to go back for repeat injections in order to see results, which are usually temporary. Scar contractures. Scar contractures can occur after burns, scalds, or when scars cross joints. Scar contractures can be improved by releasing the scar surgically. The surgeon will then lengthen the skin area by either moving healthy adjacent flaps of skin inwards or by using skin grafts. Sometimes scars are more obvious because of the direction in which they run. In some cases, it is possible to reorientate the scar by moving adjacent skin flaps around so the scar is less obvious. Other scars can be very visible because of the differences in the thickness of the tissues on either side of the wound. This happens quite frequently following cesarean sections and can be improved with scar revision surgery. It's important to explain to your consultant the history of how you got your scar and any relevant information that you may think will help. Also, keep in mind that scarring affects everyone differently. Your consultant will be able to offer you the best option specifically for you and your skin. So, that's a brief guide to scars and how to treat them. If you have any more questions, feel free to leave them in the comment section below. If you would like to arrange a consultation with me or another consultant in your local area to discuss your scars in even more detail, you can book an appointment at circlehealthgroup.co.uk.